Pleased to welcome you to a webinar that's part of our Latino Infant Initiative series with Abriendo Puertas. Abriendo Puertas, Opening Doors, is a trusted national organization that supports, honors, and invests in parents as leaders and their child's first and foremost important teacher. A little bit about the Latino Infant Initiative. We are working together as joint organizations to improve the quality of life for Latino infants from prenatal to 3 and their families. By listening deeply to Latino families, advocates, and program staff, this initiative seeks to influence national priorities and ensure equitable access to high-quality, culturally and linguistically responsive services that support the healthy development and learning of all Latino children, regardless of their background. A little bit of just general information for the webinar. We are going to have Spanish interpretation available, and I would like to ask Denise, who will be providing interpretation services, to provide us with a little bit more information about how that's going to work. Denise?
Hi, good afternoon. To access language interpretation, you will click on the globe icon that will appear after the instructions have been given. It'll say interpretation and it will appear at the bottom of the screen. It may be available under the More icon with a circle and 3 dots. You may then select your language of preference. If you're on your phone or tablet, you will tap the screen to activate the buttons at the bottom of the screen, then select the circle with the 3 dots and select interpretation and your language of preference. Tenemos interpretación disponible. Para accederla, seleccionará el icono del globo que aparecerá al fondo de la pantalla después de las instrucciones. Pueda que lo encuentre al pulsar el icono con un círculo y 3 puntos. De la lista que saldrá, seleccionará interpretación y español. Si está en su teléfono o tableta, tocará la pantalla para activar los botones al fondo de la misma. Seleccionará los 3 puntos, luego selecciona interpretación y su idioma de preferencia. Gracias.
Thank you, Denise. So we are pleased to be able to provide Spanish interpretation for our families. Just a little bit about how the structure of the webinar is going to go. We are going to have a presentation on the health impacts of federal cuts that are moving through Congress in the moment. And then we're also going to have time for Q&A, which will be a facilitated Q&A conversation. So we will invite you to ask your questions on the chat, and we'll be able to get to as many questions as we can. Just a little bit about the topic of this webinar. We are focusing on the federal cuts to programs that provide health access and food security to families across the country. And we're in a moment right now that is of the utmost importance because there are proposed cuts that are the biggest that we have seen in our lifetime that would severely impact the healthiness of families across the U.S. I would like to welcome my colleague, Stan Dorn, who is our Director of Health Policy at Unidos US and who will be presenting on this most important topic. Stan?
Thank you very much, Amalia. It's really a pleasure to be with you all, and I appreciate all the parents tuning in. You know, it's evening or late afternoon, depending on where you are, and most people have had a pretty busy day and other things you can be doing with your time, but instead you're investing this time to be with us, to learn about the threats that are emerging at the federal level and how you can protect your family and other families from these threats. And I'm just so grateful to you for taking that time and really honored to be with you this evening or this afternoon. I'm going to share my screen. Oops, come on. I'm trying to share my screen. It's not cooperating. There we go. All right, can you see it now?
Yes, we can see it.
Okay, excellent, excellent. All right, thank you. We're going to talk about a couple things. We're going to talk about what is happening in Washington, D.C. right now, in Congress in particular. This budget bill that's moving through Congress right now poses a tremendous threat to families, Latino families, but families from all different backgrounds and walks of life. We'll talk about that, and then ways that parents can fight back. But first, I just want to make clear, we're not talking about the things that are happening now. I know the feeling is, I don't know how you're feeling about it, but the way I'm feeling is like enough is enough. We have enough to deal with, tariffs going up, immigration enforcement happening. But what we're talking about tonight is not the current problems that face us. Rather, we're talking about new proposals that are coming down the pike that would be implemented in the future. And you might think, well, why are we talking about the distant future? Well, not so distant. Some of these things would happen right away. But the point is, the law is going through Congress right now, and that means by taking action effectively, we can stop the bad things from happening, or we can at least make them a lot less bad. And if you make national policy a lot less bad, you're helping millions of families. So that's why we're talking about the future tonight. What Congress is doing they're fast tracking, really rushing through a special kind of legislation that avoids a lot of the usual guardrails. Like usually, if you want to pass a bill through Congress, the House of Representatives has to pass it, the Senate has to pass it, goes to the president signs it. And when you reach the Senate, you have to get way more than a majority vote. You have to get like people from both parties, senators who agree. That's usually how it goes. It slows things down. It means Congress doesn't get a lot done. So there's this special procedure, this special super fast expedited procedure called budget reconciliation, which you can use if it's a piece of legislation that changes the tax code or changes programs like Medicaid or SNAP. And so that's what is being used right now. And so the Republicans control the House, they control the Senate, they control the White House. And so they can pass this bill without any support from the Democrats, just on their own. And they can do it pretty darn quickly. So that is what they are doing right now. And that is what we're talking about tonight. So here's the situation. Towards the end of May, the House of Representatives passed their version of the budget bill. And the final version, 1,000 pages long, came out just a few hours before the House made its final vote. Some members of the House have said, you know, I didn't even have a chance to read it before I voted for it. Some of them have said, oh my God, if I'd known what was in there, I might not have voted for it. Well, they voted for it. And it passed by a one vote margin, 215 to 214. Everyone who voted for it was Republican. A couple of Republicans voted against it or didn't vote at all. All the Democrats voted against it. If one Republican who had voted for that bill had switched sides and voted against it, it would have gone down to defeat. So we're looking at a situation in Congress where the Republicans have control, but only by the narrowest of margins. So the House passed that bill. It's now gone over to the Senate. And what's happening in the Senate is they're trying to work everything out behind the scenes. This is really hard for them. There are some Republicans who feel like, you know, we need to cut the deficit above all else, even if that means we have to cut Medicaid and health care. The others who are saying, you know, my constituents rely on Medicaid for health care and SNAP for food, and you can't cut them too far. All kinds of different perspectives. And they're trying behind the scenes to figure out what can they agree on, so that they get the bare majority of votes in the Senate, which is 50 senators voting in favor of it. Unfortunately, all Republicans, straight party line conversation right now. And then the vice president could come in and break the tie. So they're trying to figure out what is the proposal that they can come together around. Their goal is to try to pass it this month by the week of June 23rd. It will be different than the House bill. And then at that point, there will be a conversation again behind the scenes, behind closed doors, just among Republicans, figuring out, well, what can they pass that would get the majority of votes in the House and the majority of votes in the Senate? So that's going to be an important conversation. And if they do manage to get agreement among the Republicans in the House and Senate, they both pass the same bill, and then it goes to the president. So that's the process. That's where we're at right now. So what is in this bill? Well, we're going to go into a little bit of detail in just a moment, but I want to make sure you have the big picture of what's in the bill. One big part of it is taxes. It cuts taxes overall by $4 trillion over 10 years. And most of that money goes to the very wealthiest people and to corporations. So there are a million millionaires in America who file their taxes according to the people who estimated the cost here, and they get more money than everybody in America combined, earning less than $100,000 a year. That 1 million millionaires get more money from the tax bill than 127 million people earning less than $100,000. It's overwhelmingly tilted towards people at the top. And in fact, when this bill is fully phased in, people who earn $30,000 a year or less will pay more in taxes, not less in taxes. So the people at the top will get the most, and the people at the bottom will not do so well. That's the tax piece of this. And now, in order to help pay for this $4 trillion set of tax breaks, they are cutting healthcare programs, food programs, other programs, more than we have ever seen in American history, as Amalia mentioned a moment ago. So the healthcare provisions cut literally more than $1 trillion from Medicaid, also from Affordable Care Act insurance, often affectionately known as Obamacare. Now, Medicaid, depending on where you are, you may not, the term Medicaid may not mean anything to you. If you're in California, it's known as Medi-Cal. If you're in Arizona, it's known as Access. In some places, it's known as Medicaid. It's whatever the program is that serves lots of low-income people. And it is being cut by, that along with the Affordable Care Act coverage, Obamacare is being cut by more than $1 trillion. SNAP, the program that feeds more than 42 million people, is being cut by almost 30% over the next 10 years. These are the largest cuts in American history. So these big cuts are essentially moving money from working people, middle-class people, into the pockets mostly of more affluent people. That's just the long and the short of it, I'm sorry to say. There are other things in the bill, a lot more money for extreme immigration enforcement without guardrails. It's more money for deporting not just, criminals, as the president promised he would do during his campaign, but also law-abiding parents who have been here for decades, building communities. They too can be picked up, rounded up, sent to other countries, even U.S. citizen children. So we would, as much as we've seen the deportations happening already, they would be ramped up to a new level under this bill. More money for the military. Altogether, the bill increases the budget deficit by more than $2 trillion over 10 years. It makes big tax cuts. It makes big investments in immigration enforcement and military, and it pays for some of that by cutting programs that serve working people. And on balance, it increases the budget deficit significantly. So a lot of people are not terribly happy with the bill, and we at Unidos US are really doing everything we can to try to stop it, because we see it as being an incredible danger to the Latino community, as well as to Americans of all races and ethnicities. So let's talk about what the bill would do. More than $1 trillion in healthcare cuts. Medicaid is the program. As I mentioned, it might be known to use Medi-Cal, Access, something different in your state. It serves low-income children, pregnant women, seniors, people with disabilities. It would be cut by more than $850 billion, the largest cut in American history. ACA healthcare serves more than 24 million people. It serves people who earn too much money to qualify for Medicaid, but not enough to afford insurance on their own. It includes a lot of small business owners, a lot of people who work for small business. And this program as well would be cut hugely by more than 250 billion. It's never been cut by anything remotely like it. And not only does the bill make cuts, it also lets tax credits expire. Let me explain what I mean by that. Right now, there are these special premium tax credits that help people buy insurance in the ACA marketplace. And a lot of them are going to go away after this year unless they get extended. And that would double the premium costs for the more than 20 million people who buy their own insurance. The Republican Congress decided they do want to continue all the tax breaks that would otherwise expire, but they do not want to continue these premium tax credits. And that would be another major cut that the bill makes. So that's on the healthcare side. Let's talk about the SNAP program, sometimes called food stamps. Used to be called food stamps. Now people tend to call it SNAP. It's the major federal food program for 42 million low-income people. Most of the people it helps are children or seniors, people with disabilities. The proposed cuts are enormous. It would eliminate almost 30% of all SNAP funding for the next 10 years. Again, by far the largest cut in American history. So what do these cuts do? Now, the bill, as I mentioned, is more than 1,000 pages long. So we're not going to have time to, I see Timothy Corda just talked about language that limits the power of the federal courts. All kinds of really very troubling stuff is in this bill. And we're only going to have time to talk about, to hit the highlights or the lowlights, depending on how you want to look at it. So one of the key themes is paperwork burdens. So the legislation again and again and again piles huge amounts of paperwork on working families, people who may have disabilities, and says essentially, unless you fill out all this paperwork, you're going to lose your health care, you're going to lose your food. So for example, the provisions, they have these job loss provisions in the bill, sometimes called work requirements, where if you lose your job, You cannot get Medicaid, you cannot get SNAP unless you prove that you're working or getting training, or that you have an illness that prevents you from working, or you're taking care of a young child. And what we found in the past is it doesn't improve employment at all. In fact, a lot of the people who lose their health care and their food are working, or they have a disability, or they're taking care of a child, or they're taking care of an aging parent, but they didn't meet the paperwork requirements. They didn't get the form sent to them. They couldn't understand the form. They couldn't go online because they don't have broadband access. They couldn't get through on the phone. They can't take time off from work to go to the welfare office. And so literally 90% of the people who lost their health care when this was tried before should not have lost it. They were working or they were exempt, but nevertheless, because of the paperwork burden, they lost their health care, and people will lose their food in under this proposal, the SNAP proposal. Another example. Today, you have to recertify your Medicaid eligibility once a year. The bill would say every 6 months. If you are part of this new Medicaid expansion, every 6 months you have to recertify. Now we know that 70% of the people who lose their health care at recertification are terminated because of nothing but paperwork. They might be eligible as far as the state knows. And in fact, we know that the majority of Latinos who are terminated are eligible, but they're terminated anyway because they didn't understand the notice, or they couldn't get through on the phone, or they work at a job that doesn't let them take time off to go down to the office to fill out the forms. For whatever the reasons are, these paperwork burdens really have a devastating effect in eliminating healthcare and food for millions and millions of people. So that's one big theme. A second theme is a tax on immigrants. And we're not just talking about undocumented immigrants. We're talking about people who are lawfully present in the United States, often who've been here for decades, working hard, raising families, building up their communities, and now they lose health care. So, if people don't have documents and you're waiting for the federal government to confirm that you're a citizen or a lawfully present immigrant, you can't get health care under this bill. You just have to sit around and wait. Today, you get 90 days of health care while you're waiting to hear back. Not so with this bill. DACA folks, young people who came here as children, they're entitled to work in the United States. They're here lawfully. They lose healthcare coverage under this bill. SNAP, food programs. Today, if you came to the United States and you're here lawfully present because you were fleeing danger or fleeing oppression in your home country, you're here legally, you get SNAP today. Not so under this bill. SNAP will get taken away from you. You don't get enough food to eat. So that's another recurring and really troubling theme in this bill. Finally, the bill does a lot of shifting costs away from the federal government and either to states or to families themselves. So, for example, there's a huge shift of hundreds of billions of dollars of SNAP costs to states, utterly unprecedented, the amount of money that would be shifted to states. And what is a state supposed to do? They're legally required to balance their budget. A lot of states are having a hard time with their budgets right now. So to deal with this big cost shift, they either have to throw people off SNAP, they have to cut benefits, or if they protect SNAP, it comes at somebody else's expense. They have to raise taxes, or they have to cut other state programs like K through 12 education or like public safety. No matter what, this cost shift to states is going to force them to do some pretty terrible things to a lot of families who really need help. That's just one example. Another example, it raises premiums by thousands of dollars for people who buy their own insurance in the Affordable Care Act marketplace in Obamacare. You may know that as Covered California if you're in California. Different names in different places, but that's where people buy their own health insurance. And you raise these premiums, a lot of people can't afford that and will have to just drop coverage. There are provisions which say that if you're a low-income person, Medicaid is your source of health insurance. Doctors can charge you $35 a visit for the first time, and they can actually turn you away if you can't pay it. That's not legal today. It would be legal under the bill. I could give other examples, but I think you got the main point. The federal government would be shifting a lot of costs to people who are having a hard time making ends meet and to state governments that are having a hard time balancing their budget, and that would respond by cutting services that people really, really need. So we just got the official estimate from the Congressional Budget Office today of what the House bill would do. It would eliminate health insurance for 16 million people. And the odds are that would include 3 to 4 million Latinos. But whoever you are, if you don't have your health insurance, that means if you're somebody who has a chronic illness, you can't go to the doctor, you can't fill your prescription, you just can't afford it. It means if you're a woman and you have breast cancer and you don't know about it, it's not going to get diagnosed and it may be too late to treat. It means that if you, God forbid, get hit by a car and you get a big hospital bill, you're going to have to pay that yourself. And, we know that when you lose your health insurance, the chance of eviction goes up by 25%. So it's a lot of increased costs and pain that is being dealt to tens of millions of people under this bill. And in terms of SNAP, the food program, the Congressional Budget Office and other analysts expect that 7 million people will lose most of their help or all the help from SNAP. Children, more than 2 million children would lose SNAP. Even if you get your SNAP, the benefits are going to go down by more than $300 a year for most people. And right now, it's not the world's most generous benefit. SNAP at most pays $2.84 per meal. So if that goes down, it's going to be tough. And as is in most of the country, you cannot feed your family nutritious meals using SNAP. And that gap between what people need and what people get is going to grow larger and larger and larger under this bill. So the results would be really bad. Now, in today's conversation, we're focusing mainly on healthcare and food, but the bill does a lot of other things. We've had some comments in the chat about that, for example. Just a couple things to mention. It raises taxes on low-wage working people. So right now, there are 4 to 5 million kids, U.S. citizen kids. They get $2,500 tax refunds that go to their parents. That would disappear under this bill. Why? Because one or both of their parents doesn't have a Social Security number. And so those families don't get that $2,500. And that makes a big difference for people. I mean, you all know when people file their tax returns, that's often when you get a refund and that you can use that for fixing your car or, fixing your refrigerator, what have you. And a lot of that money is just going to be gone. Pell Grants are slashed, much harder to get, much smaller. Other student aid is more difficult to get. Repaying your college loans, that is a lot tougher under this bill. It's going to lock the door to a better future for a lot of Latino children and a lot of children from other families that are just having a hard time making ends meet and they want a better life. And this bill is going to shut that off for them if it passes. And it may not pass, as we'll talk about in just a minute. And then the final thing I'll mention is just there's additional funding for really extreme immigration enforcement. We've already seen this happen where people, law-abiding folks, moms and dads, raising families, working in this country for 10, 20 years, suddenly get picked up and sent away. And American children are sent away, even those who are sick and need health care. And this could get a lot worse if this bill passes. I mean, people are being, for the first time, picked up when they go to church, when they go to school, when they go to the hospital, when they go to court. It's just very troublesome right now, and it could get a lot worse under this bill. So you can see why we at Romulus US are very troubled about it. And families from every walk of life are going to be hurt by this bill. We think Latinos are particularly subject to danger under this bill. Why is that? Well, 25 million Latinos rely on Medicaid and ACA for health insurance. Latinos are more likely to work in low-wage jobs that don't have health benefits, so that means they're more likely to qualify for these programs, to need these programs. That means if these programs get cut, Latinos are going to wind up being hurt. And already, almost 1 in 5 Latinos doesn't have health insurance. And that's much worse than much of the rest of non-Hispanic whites. 1 in 15 doesn't have health insurance. So the community has made incredible gains over the last 10 years, but those gains are fragile and could be disrupted. So there's a lot to lose on healthcare for Latinos in America. When it comes to food, same thing. SNAP serves 10 million Latinos, half of them are children. And, despite SNAP, even so, 2 out of every 5 Latinos reports that they don't have enough food to eat. 1 in 8 Latinos has had to go into debt to pay their grocery bills. And all of these problems will get much worse if this bill passes into law. So what can we do to fight back? How can we stop this bill from passing into law? Well, we got a shot. There's 2 goals here that I want to just share with you. One is we want to influence the conversation behind closed doors. You remember I told you about how over and over again, the Republicans are having these conversations behind closed doors saying, what can we do that we get it, that everybody will support or that enough people will support that we can pass this bill? They need to get almost everybody on board. So what we want to do is make it so as many Republicans as possible are saying to their leadership, you cannot ask me to vote for a bill that makes these kind of cuts. If you do, it's going to hurt the people in my community. And you know what? They might not reelect me next time. So absolutely, you cannot make these cuts because there's going to be other Republicans who are going to say, you got to make more cuts. You got to cut more. We got to cut the deficit more. The goal here is for as many Republicans as possible to say, no, 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 my community cannot abide by these cuts, and I might lose my seat if you force me to vote for these cuts. So don't put this into the bill. That's one goal. And the other goal is ultimately there will be votes. And the bills that come out may not be so great. And we want as many Republicans as possible to vote against it. If we just get a few to vote against the bill, it goes down to defeat. Now, things are looking tough right now, but I'll just mention 2017, the last time the Republicans controlled the House and the Senate and the White House, they were trying to repeal the Affordable Care Act. It looked bad. It passed the House, and it went down by one vote in the Senate. So, it's tough. But if we all work together effectively, we, I think, can really either stop this or make it a lot less bad. And making it a lot less bad is a good thing for a lot of people. So why do we think that we can influence that conversation happening behind closed doors? Well, bottom line is nothing motivates a politician more than wanting to get reelected. And when they hear from their constituents, they pay attention. If a bunch of their constituents say, please don't vote for this, it will hurt my family, it will hurt my community, that will change how they act. So you need to find who are your representatives in Congress, who's your member of the House, who are your senators. Here's some places you can go online to find out those names and let them know how you feel. If you think this bill's a good thing, you should tell them. You should participate. If you think it's not, you should share that view as well. Here's one number, the Capitol switchboard number, that will get you through to any of your representatives. You can send them an email, you can send them a text, you can write them a letter. They pay attention to all of these things. You can connect with neighbors and together go and say, we'd like to meet with our congressman, we'd like to meet with our member of Congress or with their staff and tell them how they feel. There are events that are maybe happening in your community. Keep an eye out for these things. And you can go and participate and make your voice heard. There's a lot of ways to make sure that your elected representatives know that you care about this issue, that you're watching what they're going to do, and you're going to pay attention, and they may be held accountable for what they do. So what are some things to say? Well, I think none of these things will come as a surprise to you. Families already are having a real hard time making ends meet. Costs are up. It's hard to make them and to pay those costs. And if you pass a bill that takes away money paying for healthcare, that takes away money paying for food, you're going to make things a lot worse. People in Congress ran for office saying, vote me in and I'll help you with those costs you can't afford. This bill would do the opposite. It would make those costs go up, not down. These are huge cuts, more than $1 trillion in healthcare, more than 30% of all SNAP dollars. This will hurt seniors, children, people with disabilities, working families. When you just talk about who the human beings are at stake, that really moves people and that can change hearts and change votes. Another point worth making is Washington lawmakers are moving too far, too fast. They're making these big cuts and they're not doing it carefully. They aren't even reading the bill before they pass it. Instead of going too far and too fast, they need to slow down, be careful, and make sure they don't hurt innocent people. Now, we're hearing some Republicans who voted for this bill saying that it's not going to hurt anybody. The only people it's going to hurt are people who are cheating the system. And that, I'm sorry to say, is just gaslighting. You cannot cut health programs by $1 trillion. You cannot eliminate 30% of all SNAP money and pretend that, oh, nobody's going to be hurt. These are the biggest cuts in American history. When we had cuts before, millions of people lost their health care. People with disabilities, seniors, children, people lost their food. And these cuts are way worse than those cuts, and they would have more harmful effects. It's fine to say you want to improve these programs. Everybody wants, but definitely let's cut waste, fraud, and abuse. But you got to do it carefully. These are life and death programs for millions of families. If you want to make them more effective, and you need to take your time and do it right instead of rushing like crazy. Instead of they need to use a chisel or a surgical knife. Instead, what are they doing? They're using a chainsaw and slashing quickly, and that there's no way you can do a responsible job improving these programs. If you punish people who lose their job by taking away their health care, by taking away their food, that doesn't improve their job prospects. It makes it harder to work. If you don't have enough food, if you don't have health care, it's harder to get up and go to work. And it's just going to hurt the people who need help, and use the money to help pay for tax cuts that primarily benefit people who really don't need the help anymore. So the long and the short of it is we've got some tough challenges that are facing us right now, but this is the moment where we can engage and we can change what happens in Congress and protect the families that we're all here, protect your family, protect your community, and we can work together and we can make this a much less harmful piece of legislation, and maybe even stop it altogether. Now, I'll just mention and we're going to share these slides, of course, with everybody. At the end, we've got numbers for every state in terms of how many people would lose their health care, how many people might lose their SNAP. So when you have those conversations with your members of Congress, you can use the numbers that apply for your state. So did I stop sharing my screen?
You can stop sharing, Stan. And yes, we will be sharing both the recording and the slides with everyone following the webinar, along with some resources. And then we also have the Q&A open for questions. So while we wait for some folks to add their questions in, thank you so much, Stan, for all of that very critical information. And also, I think what's especially helpful is some of the messaging that you shared that actually is working, right, and being effective when communicating with congressional offices, not only with respect to how the impact of these proposed cuts would impact families, but even strategically responding to the messaging that they're providing back to us. That's very, very helpful. One question that I had, and I know you in the slides also provided state by state information and data that advocates can use, because I know I saw on the chat that we have representation from a number of states. I'll just call some out that I saw: North Carolina, Arkansas, Alaska, New Mexico, Colorado, Illinois, and others. So I think having that state specific information is super helpful. And I did want to ask one question in terms of, I know one of the slides that you shared elevated the impact that this would have on states themselves, right? As the responsibility for funding these programs shifts to states, many of whom are facing their own deficit and budget constraints. So do you know, has there been any,
See, Amalia, I think you froze, but I think I know where you're going with this. I think Amalia can you all hear me?
Yes.
Okay, so were you going to ask me, are there any state numbers about how much is getting shifted to the states?
Oh, no, in terms of how states are responding, states who have their own constraints are responding to more of the funding responsibility being shifted on.
So sort of like this is a bill that has not passed. It's not current policy. It would, if Congress passes it, it would push all these costs onto states. And exactly as you said, states have to balance their budgets, and how would they deal with it? They would deal with by cutting benefits that people need. We don't yet know what exactly states would do, but we do have numbers about how much the cost shift would be and how a state might accommodate it. So like one state might be able to accommodate it by eliminating a quarter of all funding for K through 12 education, or cutting, a third of funding for police and fire protection. I mean, these are huge, huge cost shifts, and if folks know people in county government or local state legislators or people in state government who have relationships with Republican officials in Congress, boy, now is the time to use those relationships and say, do not pass the buck to us. Do not, pretend you can push costs onto us and it's not going to be, your fault. You would make things really bad for people that you care about. You would by pushing the buck onto us and making us make all these cuts. So, if anybody on this call has relationships with those state and local officials who can talk to Republican officials in Congress, now is really a good time to use those relationships.
Thank you, Stan. That was really helpful. We do have a question from the chat, and the question is from Valeria Garcia, and it is, are there examples of community-led initiatives that are proactively and creatively preparing for or fighting against the impact of the proposed federal cuts?
Yeah, there are all kinds of communities who where people have been meeting together and holding roundtable discussions about what the cuts would mean, um, and using that to educate the community and to get coverage in the press. Um, and that puts pressure on members of Congress and can help stop the cuts. There are places where, members of Congress have not wanted to defend their decisions in public, so have refused to hold town halls. So people in the community have held their own town halls and had invited the member of Congress, had an empty chair, and talked about it and gotten into the news. There are, people who've written letters to the editor in the newspaper about what it would mean. I mean, voters have tremendous power, and members of Congress really care about what they are hearing from their voters. So there's a lot of creative things that people have been doing around the country to mobilize and put pressure on their members of Congress not to make these terrible cuts.
Thank you, Stan. We also have a call to action that we'll share towards the end as well. I have another question that came in, and it is from Brooke. And she said, do you have any information about how public housing would be affected? We learned in Fresno, California, that half of those with housing vouchers would be cut and likely evicted. Affordable housing is just not available, and there's a huge number on the waiting list.
Yeah, I don't know anything about the housing provisions in the bill. We'll have to get back to you on that. If you could, let's see, Brooke, if you could share your contact information, we'll try to get back to you on that.
Dan, on the timing for the Senate, which will be taking up this proposal or this bill.
Amalia, you froze again. Oh no. Stan, you're on mute.
I see your face, Amalia. Give it another try. What's the timing in the Senate? So right now, senators are meeting behind closed doors to figure out what they have the votes to pass. Um, and there's like all these complicated rules they have to satisfy. But like over the next, this week, next week, the following week, they're trying to figure out what can they get 50 votes for. So, if we can try to make sure senators know that voting for these big cuts is going to be bad for their communities and potentially could hurt their ability to get reelected, that will shape that conversation and that will shape the Senate bill. So that's happening right now. The majority, the leaders, Republican leaders, are trying to bring it to the floor by the end of the month. They want to the language, the bill language is going to start coming out this week, next week, committee by committee, and they hope to put it all together by the end of this month. So that's where we are in the Senate.
Thank you, Stan. I do see a couple of comments coming in. Thank you, Brooke, for sharing that. Stan just posted his email. And then Ashley shared that Feeding America has an advocacy toolkit, and she shared the link on the chat. And it seems like it has a tailored message to specific states. So that's amazing. I'm happy to see all of these toolkits that are here. And then someone also shared, and I'm sorry, I don't want to butcher the name. I think it's Siobhan, shared a link to 5Calls, which seems to be a link to make a call or sign a petition or join a list to get more info on a specific issue. So I know that there's plenty of organizations fighting this together. So that's amazing to see. Are there any additional questions? Amalia, did you have any additional questions?
No, and I took myself on camera in case I freeze again. But no, I just wanted to thank Stan for sharing his expertise. I think one, not a question, but a comment that I had, Dan, as you were presenting, was just the compounded effect that these proposed cuts would have on families that are not only challenged with food insecurity, for example, and health insurance access, but also, you mentioned the potential impacts also on tax credits for working families, and also for parents, caregivers who may be trying to continue their education, right, to get a better job through post-secondary education. And I know my team who works in higher education were laser focused on the potential cuts to the Pell Grant, which supports first generation college students, right? Many Latinos are the first in their families to attend college. And for many, they come from low income households. And so that is definitely a barrier in post-secondary access. So, it's clear to me too, just in terms of the full picture of the compounded effect that this particular bill would have on families.
I agree with you totally, Amalia. I usually agree with you totally. There's no exception.
Right. And just to say, right, yes, the picture in terms of what is being proposed looks bleak, but we wanted to provide this information because there is something that we can do about it, right? We have the power of advocacy, not just professional advocates like Sten and I, but everyday citizens, parents, and community leaders. Because it's especially important for Congress folks to hear from their constituents. They hear from national organizations all the time, but it's so important when we localize the issues, and constituents themselves are the ones, providing those messages. It's a lot more compelling a case to be made. So definitely encourage folks to, as I've seen in the chat, share resources with each other, connect with one another, and make sure that you have your voice heard with your Congress member, because there's still time to stop this thing.
Yeah, and it's gotten as bad as it is, it was going to be worse. I mean, there were other things they were planning to do to Medicaid that would have been worse, and they're not doing them because some Republican members of Congress said you can't do that. That would be too damaging. And now we just need to make it less bad. But the point is, the pressure that people are bringing it's working. We just have to keep doing it, and we may be able to stop this thing entirely. And if we can't stop it, we're going to be able to make it be better than it otherwise would be. And that's what we're doing, fighting for our families and our communities.
Thank you, Stan. I just have one more question that came in through the chat. And I'm not sure if you'll have the answer, but is there any entity that oversees insurance companies, since in some cases the cost of medicine is excessive, or they detail some medicines that are not provided, and that also affects people when they receive the bill?
Yeah. So in terms of medicines, that's overseen by the Food and Drug Administration at Health and Human Services. And that's being cut right now by the Trump administration, unfortunately. In terms of prices of drugs, in this country, we pay more for our medicine than people in any other country. And these last couple of years, there was some improvement in that. With the Medicare program, there were limits placed on how much drug companies could charge for certain drugs. And there's still a fight going on that right now, where drug companies are trying to push back against those limits. I don't know if that's a really good answer, but the Food and Drug Administration regulates drugs nationally. In terms of insurance costs in your state, each state has its own insurance department that regulates insurance companies, and you can bring complaints to them. A lot of those state insurance departments are really quite good.
Thank you, Stan. I have one more question, and that is, what has been the most effective messaging for Latinos who are supporting and embracing MAGA policies?
Well, I guess one thing to say would be this is not what we voted for, right? We voted for help with costs we can't afford that were out of control during the previous administration. And they're making it harder for us to cope with these costs by taking away help paying for Medicaid, taking away help paying for food. Um, that's one thing to say. Another potential thing to say is, look, we can improve these programs. We should improve these programs. Every program can be made better, but that's not what they're doing here. Um, they're not going after, the greedy corporations that rip off the taxpayers, rip us off as individuals. They're not going after scam artists who abuse our seniors and people who, are having a hard time taking care of business. They're going after, children, older people, people with disabilities, because they want to get that money and use it to help pay for tax cuts for people who already have plenty of money. So I guess the thought would be, yes, we absolutely should be making these programs better, but that's not what this is. And these are the biggest cuts ever in American history. You can't pretend that you can do these things overnight, not even read the bill, and do a good job. I mean, yes, we want these programs to be better, but for goodness sakes, read the bill. Don't rush the thing through. They are moving too far, too fast. They're not doing their job properly. So those are some of the messages that maybe can work. Another sort of thing to talk about is how we're all in this together. That if suddenly a whole bunch of people lose their health insurance, guess what? They're still going to go to the hospital. They're still going to get sick, and the hospital's going to take care of them while there's an emergency. Who's going to pay for that? The rest of us. We all pay more in our insurance when we have neighbors who don't have insurance. What's going to happen when when children don't get enough food to eat? They're not going to grow up healthy. They're not going to be able to support themselves. We know that investing in children's health pays off in the future with kids who, as adults, can support themselves and contribute to the community and contribute to the economy. This is counterproductive. We're cutting off our nose to spite our face. So those are some of the things. I don't know. Hope that helps.
Thank you, Stan. I don't see any additional questions that have come in. And like they mentioned, we will be sharing the slides, the recording, and the links that we'll be sharing in an email. And we just got a comment from Kimberly in Spanish, just sharing that where she's at, in order for children to have access to daycare of 0 to 5. Sorry, I'm trying to translate it at the same time. They have to have Medicaid.
Mm.
So it
Boy, that's such a great point. Like when kids lose Medicaid, they may lose daycare and also WIC, the food program that feeds has tailored nutrition for pregnant women, little babies, new moms, infants, toddlers, preschool kids. If you get Medicaid or if you get SNAP, you're automatically financially eligible for WIC. When kids lose Medicaid and SNAP, that means a lot of them are going to lose WIC. A lot of them are going to lose access to free meals at school, which is the one nourishing, healthy meal that a lot of children get during the day. So, and these are unintended consequences. I mean, this goes back to they're moving too far, they're moving too fast, they're doing things and they're not even thinking through what the consequences are going to be. And they need to just stop and take the time they need to do a decent job and protect their constituents. I mean, they were sent to Washington to make working people's lives easier, and instead they're making working people's lives a lot harder if they vote for this bill.
Thank you, Stan. With that, we are going to be wrapping up the Q&A session, just out of respect for everybody's time. Thank you. I did see in the chat several links of actions that different organizations are taking to fight this, and I love to see that. That's great. I'm happy that everybody is uplifting their voice during these times when we absolutely have to. The budget could make deep cuts to programs that our families rely on, and these are lifelines for so many in our communities. If we don't speak up, these cuts will go through quietly. So it's nice to see that we all know that we have the power to raise our voices together. So along with some of those links that other folks shared on the chat, we have put together an advocacy form. You're welcome to share it, sign it. The form has been shared on the chat, and we have an English form and a Spanish one if you work with Spanish-speaking folks. And yeah, let's show our leaders that our families are watching, they're engaged in this process, and that we expect better. So thank you for standing up for what's right. Thank you, Josefina, for sharing those. So like I said, there's one in English, one in Spanish. Those will be included in the email that will be shared in the next couple of days. And then I also wanted to share that Abriendo Puertas and Unidos US is having another webinar on June 26th to officially launch the 2025 National Latino Family Report. This is an annual report. I believe it is the 4th year that we do the survey. So we will be sharing those survey findings and officially launching our website with all of that data that you can use in your policy efforts and share back with families. That will also include top lines for 5 states. Those 5 states are California, New Mexico, Texas, Arizona, and Florida. So if you are in one of those 5 states or you do work in one of those 5 states, please be on the lookout for that. There is also a lot of data there that we have been uplifting, and you'll see it on our petition forms around SNAP, around WIC, and something that I feel like we all know, but 96% of Latino families say that it's important for Congress to lower the cost of healthcare within the first year of administration. So hopefully with all of these petitions that all of our organizations are putting together, Congress is listening to the needs of Latino families. But thank you all for joining. We really appreciate that you shared a part of your evening with us. If you have any questions, please feel free to follow up and look out for that follow-up email with a recording, the slides to Stan's awesome presentation, the links that we shared, and future calls to action. And please reach out if there's anything that we can support you on. So that we can all fight this together. Thank you, everybody.